We are good.
Go.
Yes, sir.
Hello, this is Rodney from Howley's Restaurant. Today, in partnership with Delivery Dudes and Troy's Barbecue, we provided 2,200 free barbecue meals to those in need, to laid off hospitality workers, but anyone that's been laid off due to the coronavirus. We're doing this 7 days a week in partnership with our new charity, which is hospitalityhelpinghands.org. You can donate there. You can sign up to volunteer. We are starting a food bank that's going to be every Wednesday, and there'll be information on that on our website. We are also open a second location, Hullabaloo on Clematis Street, where you can also pick up free meals. And starting Tuesday, we will be opening the Dubliner and Kapow in Boca Raton and Meisner Park, also providing free meals to those in need. We partnered up with go2flu.com to try to ease some of the nerves of a lot of people at home as far as how they're feeling and if they get a little bit of a cough or sniffle. And rather than bogging down our entire system, this is a great opportunity to get pre-qualified, and they can answer all these questions. So we have paramedic and doctors here that can answer your questions going forward. And if you like to donate, it's hospitalityhelpinghands.org, and we're at Howley's 7 days a week. Thank you.
Up next is paramedic Christopher Woodcock.
Hello, everyone. Just want to take the time to talk to you a little bit about the role of the EMS personnel during this crisis. I'm a former paramedic firefighter from Seminole County, Florida, and I know from firsthand experience that we run a lot of different types of illnesses. And at this time, with so many people having symptoms, I'm sure they're being bombarded with scared people, thinking they may have the virus or something else going on. They want to get checked out. And what we're pushing for right now is trying to tell everybody that we don't want you necessarily calling 911 to be evaluated by paramedics, only if you have a severe medical illness, not just because you think you have the virus. And where this stems from is that a few weeks ago in Seminole County, we had some guys go on a call, some of the paramedics go on a call, and they transported a gentleman that actually had COPD, and they'd run on this gentleman many times before, and just assumed that he was having the same COPD problems, when in fact he was tested for the COVID-19 virus at the ER and found to have it. That in turn put those people, it turned out to be 9 EMS people, on a quarantine away from work for over 14 days. Now, when those guys went home to their families, they had to be quarantined knowing that they were exposed to a COVID-19 patient. So now they have the possibility of exposing, their wife, their children, parents, grandparents, whatever it may be, and we don't want that to happen. We're trying to keep these numbers down, trying to make sure everybody is going to be safe. In just a second, I'm going to pass this over to Dr. Ben Abo, and he's going to discuss the safe practices we need to keep in mind for keeping us virus-free and helping others be virus-free. So without further ado, I will pass you off to Dr. Ben Abo. Thank you.
All right. Thank you, Chris. There is nobody within at least 6 feet of me, so I'm going to take my mask off so that you can understand me. I appreciate being here, and I appreciate absolutely everyone's doing for their communities, especially. It's pretty impressive what's going on here at Howley's and all in Palm Beach. It's really important that with all the information that's out there, that it's the correct information. We're going to go ahead and answer a number of questions that a lot of people have, because people are scared, rightfully so. But also there's a lot of people that aren't scared because they're in denial about what's kind of going on and who's at risk, who's more at risk. Just because the elderly or the immunocompromised are at higher risk doesn't mean that young people aren't at risk. In the past 2 days, we've had multiple medical residents in Detroit and New York City die trying to take care of people that were sick in their 20s and 30s. There's a lot that's going on. So there's things that you can do to make yourself feel better, make yourself feel safer, and actually be safer, not just feel safer. just because you get tested doesn't mean that you're completely safe and you don't have to worry about it anymore. And the whole point of what we are trying to do as a group is put the right information in your hands. We can easily say, come to the emergency department, we will always take care of you. But if you don't need to be there to put yourself at further risk or to put others at risk, then don't show up in the emergency department. Don't just call 911 unless it's an emergency, because we will always be there for you. We can say, oh, just call your doctor, but a lot of people don't have access to their doctor or even a doctor or medical professional. So what with coronatelemed.org, the whole point of what we're trying to do is almost broker to put you in touch with somebody that's appropriate to answer a lot of questions, to do an assessment, a physical exam as best as possible, to put you in the right category. And if you need testing, we will set you up with that testing. And if you need directions or information in terms of how to isolate, how to quarantine, how to self-care, or even how to care for others that might have coronavirus, what warning signs to look out for, how do you do that? We're going to get you that information and follow-up information. So we've had a number of great questions thus far, but some really important things is take this social distancing very important. Take it to heart. Listen to medical professionals with what we're trying to say with social distancing, with washing your hands, with cleaning surfaces, with wearing a mask out in public, with leaving the N95 and N99 masks to the professionals, not because you might not be able to use it, but because you might be putting yourself more at risk by not using it appropriately, and you might not need to that level. So I'm going to go ahead and turn it over to see. We have a number of people in this Zoom meeting for questions. So we're going to go ahead and answer a number of them. Best thing to do is go ahead and type to our chat page within the Zoom your question. That way we can go ahead and do it. As you can tell, and you can probably hear, if there's a mirror, you'd be able to see that for the most part, this is an empty room. Why? Because we're trying to promote that importance of social distancing. So go ahead and through the chat window, go ahead and ask any questions. Like I said, what we will do while you're typing in those questions at gotoflu.com or coronatelehealth.org is wherever you are, we will kind of broker and ask some basic screening questions and put you to the right professionals so that we can affordably get you in the right direction. If you need instructions, if you need prescriptions, we will have that taken care of for you in a HIPAA compliant privacy way. So, Brent, do we have any questions there? Oh, there's a bunch there. Nice.
First question is, what symptoms should I be concerned about?
Symptoms to be concerned about, that you're more likely to have coronavirus is similar to also some other diseases, but I'm worried about fevers. I'm worried about diarrhea or loose stools. I'm worried about shortness of breath. I'm worried about a cough. This virus really tends to be kind of the lower airway kind of thing. So symptom-wise, that low-grade fever, the diarrhea, the cough, the shortness of breath. What I worry about in particular is how short of breath are you to help decide, do you need to be in the emergency department or do you need to take care of yourself at home? So if you're really getting short of breath, say to walk to the bathroom or walk to the fridge or walk to another bedroom or something like that, that's pretty short of breath. That's not what I would call normal. That's where I'm a little more worried. But if you have a cough and you can be able to walk a parking lot or anything like that, then you can go ahead and you can stay home. But diarrhea, fever, shortness of breath, cough, these are signs and symptoms of coronavirus, but also a number of other different things. What else you got?
The next question that came in is, what do I do if I start exhibiting symptoms or what I think are symptoms of the virus?
What to do if you think you're starting to show signs or symptoms of the virus is first ask yourself, how are you doing? Take a deep breath, calm down. And if it's severe, shortness of breath, then you need to get to the hospital or you need to contact, you already set up telemedicine or call your physician. If you're not severely ill or severely short of breath, then give us a call or go ahead on the website or contact any provider or look at the CDC recommendations or the Department of Health recommendations to help guide you for what's going on. The thing with all this is it's not just a do you have coronavirus or not. Just getting a test isn't going to answer things for you. We need to still take care of you, not answer a yes or no test. So during this also, the virus and the pandemic doesn't understand that we also have other illnesses that are still going on. People are still having heart attacks. They're still having strokes. They're still having just a general virus. They're still getting bacterial infections. So we need to take all that into account so we can put you in the right direction, the right treatment.
Can you demonstrate how to put on a mask for everybody? Because some of these masks are not the same.
That's a great question, Chris. So in terms of putting on a mask, depending on what masks you have, if they're the surgical masks, they're usually going to be colored on one side and light colored on another, and there's going to be some metal often at the top. The metal part should be at the top and the color being away from you. And what I do is I never actually touch the mask itself as much as possible, but I go in ahead and I spread this. I'll put it on over my ears and make sure that it spreads out as much. And I go ahead and I pinch around the nose so that you can see here, there's no space above. And what that's going to do is a lot of protection. These are the kinds of masks that you should be wearing, or handkerchiefs and things like that in public. If you have one where it has the bands, you can see I took it off there. If it has the bands that are connected around the top, then usually the bottom one crosses to the top and the top to the bottom. Once you put it over, and you would put the mask on first and then bring it over so that you can assure proper connection. But again, the metal piece needs to be pressed down. And whatever mask or handkerchief you have, you need to take that into account, knowing how to put it on properly. In terms of gloves, so I was asking, if you're doing activities or anything like that, just wearing gloves does not automatically shield you, okay? If you're doing things like pumping gas, touching the key thing, using an ATM, sure, put on a pair of gloves, but then you immediately take them off and still wash your hands. And don't toss these gloves on the ground. I want you to properly throw them out. But walking around, touching your cell phone, touching your mask, touching your face, picking your nose. I've seen people actually eating food with gloves on, and I've actually seen people picking their teeth with gloves on. That's not doing anything. That's a false sense of security. So just wear the proper masks, wear the gloves when you need to, and then take them off. But know that there's proper ways to take them off, and you still have to continue to wash your hands and do all that with due diligence.
We've got two more good ones here. First, can you get the flu and the coronavirus at the same time? And what are the differences in symptoms?
For a two-part question, can you get the flu and coronavirus at the same time? There initially were thoughts that you couldn't because there's the same receptors and all. However, it's really hard to tell when you're getting something versus something else. I've had someone recently that was extremely sick that I ended up having to do a crash intubation, putting that sweetheart on breathing support that was being treated for influenza A. She tested positive already, not even 2 weeks earlier, and now she had coronavirus. So you absolutely can have both at the same time. Can you get it very close together at the same time? I don't know, but you absolutely can have both. And that's where just getting tested doesn't really give you many answers with it. Usually with the flu though, there's a little overlap with the symptoms and all, but usually with the flu, it's a cough, it's runny nose, it's congestion, it's fevers, and it's the body aches. And after a couple of days, you actually feel like the train is hitting. If you've ever had influenza, it's really remarkably horrible experience that usually lasts 7 to 14 days, as opposed to this, which can start out just a cough, a fever, not really having the aches and pains, some diarrhea, but then you get shortness of breath. And people range from relatively asymptomatic to severely ill very quickly.
You say someone has the flu, does that mean they just have respiratory problems, or can it be gastrointestinal too?
When somebody has a flu, they can have some gastrointestinal issues as well. Like I said, there's a lot of overlap as opposed to It's not one or the other. There's all shades of gray.
We have time for 2 more questions.
Okay.
This person asks, our governor is asking us to use DIY fabric masks. What is the best material? How and when should I clean it?
Good question. So first, the do-it-yourself masks. You went ahead and threw something on here. I'm not going to really touch it because it really hasn't been cleaned. However, you know, there's materials online from the CDC telling you about things. I know that there's something like 250 thread count or something like that. The higher the threads, the better would be. So there's a lot of great ways to do it out there. I enjoy and I like that the public are starting to wear things like this in public. This is the type of thing that I actually wear when I'm usually out in public around anybody else. You should clean it. I would try and clean it once a day, or anytime it gets wet, you definitely should be cleaning it. And you can wash it. That's the beautiful thing. But there's plenty of things, and you can see, guys, if you're linked to it from a physician or a PA or the sorts, or the CDC, WHO, and how to make the mask, that's the guidance that I would go for, not just someone on Facebook giving you a good idea. Good question. And there was another question on there?
Yep, and our last question is, how do I obtain a COVID-19 test?
How do you obtain a COVID-19 test? Well, first off, you need to make sure that you actually need a COVID-19 test. And that's why you need prescriptions and you need a physician to do it. If you think that you have coronavirus or COVID-19, then you need to contact your physician unless you need to go to the emergency department. And if you don't have one, or if you don't want to find yourself seriously ill, you can go to gotoflu.com or coronatelemed.org, and through our privatized telemedicine, or rather private for it, telemed, we'll go through screening questionnaire, and you will talk to an actual licensed provider. And if they deem that you need to get COVID-19 testing, or that you would benefit from it, then we will just take care of an electronic prescription to help you find the best place to go, whether it's the Department of Health or a drive-through testing center, or certain places where they have testing centers set up. So we will literally help you take care of that on our end through an electronic prescription. Any other questions there?
No, that is it.
So
Any other questions?
if you have any other questions, you can go ahead and contact us at the website or through Zoom, and we'll answer more questions. The important things I want you to take away from this are, number one, you need to stay safe, and don't assume that other people staying safe are going to take care of you. There are people out there that are absolute denial in terms of the dangerousness of what's going on, and it's a real shame that my survival depends on other people having common sense. So please take care of yourself. Wash your hands often, wash them well, wear a mask whenever out in public, take social distancing very seriously, no matter what your age is. And remember, just because certain age groups or immunocompromised are at higher risk, it doesn't mean that you, being young, are not at risk, because people are in fact dying. And those that aren't dying, many are quite sick. So please take this seriously and listen to licensed professionals. Be well.